This is Nico. Nico's a female Geoffroy cat. In the wild, this species is found in South America, and they usually have a spotted gray-brown coat. But Nico's melanistic, just like our black leopards, and she's actually the smallest cat we care for here at the sanctuary. Nico was born in 1993, so she's getting very old for a cat. She's also often mistaken for a domestic cat or kitten by our tour guests. But all the staff and volunteers at the sanctuary are well aware that she's still very much a wild cat, despite her small size. At feeding time, keepers have to carefully place food inside her lockout while always paying very close attention to where her tiny and incredibly fast paws are. Lockouts are the smaller areas attached to the main enclosures at Big Cat Rescue, and all of our enclosures have these. This is where the cats are fed daily and where they can find fresh water 24/7. It's also where we can observe the cats from every angle when we feed them, to make sure they're looking good. And it also acclimates the cats to being in a smaller area without them realizing. Keepers noticed that Nico's face looked a little swollen on one side. After I verified this, we then had to get Nico into a squeeze cage. This is another reason why lockouts are such a good idea. To do this, we simply drop some food in her bowl. Then when Nico entered the lockout, another keeper lowered the door down behind her. While Nico was eating, we entered the main section of her enclosure and put the squeeze cage up to the lockout door. Then we slowly raised the door, and because the squeeze cage was dark and therefore safe in Nico's mind, she ran inside and we closed the door behind her. This process creates the minimal amount of stress on the animal. Because this was in the evening, Nico was kept in the cat hospital overnight to be monitored. We gave her antibiotics, and then in the morning we took her to Ehrlich Animal Hospital. This is where the squeeze cage is very effective, both in making our job simple and safe, and again with the minimal amount of stress on Nico. As you can see, we just lift the floor of the cage upwards, giving Nico little or no room to move around. So then Dr. Wynn can easily inject her with the sedation drugs. Then we lower her back down. Once Nico was sedated, she was given an overall physical exam, where we take the opportunity to check for anything abnormal. And as we thought, it looked like the cause of the abscess was a bad tooth. Nico was weighed, and she tipped the scales at a whopping 4.4 pounds, which is even smaller than Canyon, our sand cat. We drew blood so we could test her organ functions.
They're bitty tubes that you only need to fill between those two lines, instead of filling these tubes with a lot of blood.
While we were setting up for the procedure, we trimmed Nico's claws. Then we used a syringe to remove the excess pus before we removed any teeth.
So we're going to open that up in a second.
Dental x-rays were taken to determine the condition of her teeth and how to proceed.
But this tooth, see that? That's where this tooth is rotten, so we're going to pull the tooth that's left.
Her teeth were cleaned and the rotten tooth was very easily extracted. Another tooth appeared to be broken on the x-rays, so this was also removed so there was no chance that Nico would have to repeat this process in the future. We then focused on the abscess, thoroughly cleaning this out and flushing with an antibiotic rinse to make sure as much of the bacteria was removed as possible. Finally, we gave Nico her vaccines and microchipped her. Then it was time to slowly wake Nico up.
Still getting oxygen, so that's helping her come around, because she'll wake up when the gas is either completely out of her system and also when the drugs that we gave her to make her sleepy wear off.
Once she was beginning to react, we transferred her back to the squeeze cage and then back to the sanctuary. Nico is fully recovered now. She's back to her old self and eating well. Once again, we'd like to thank our supporters for enabling us to provide the best animal care we can for our residents, big and small.